African Americans in the opioid epidemic. You may be asking yourself, what is the opioid epidemic? The opioid epidemic at its core refers to the alarming increase of death and hospitalization of people due to unprohibited usage of prescription, illegal, or synthetic opioids. Now that we've identified what the opioid epidemic is, we should ask ourselves, what are opioids? Opioids are drugs that are developed from the resin of opium poppy and are considered byproducts of opiates like morphine, codeine, or heroin. Although opioids are byproducts of opiates, they are still highly addictive and just as dangerous if not used properly. So far, we've discussed what the opioid epidemic is and what an opioid is. Let's take a look at a couple of opioids involved in the opioid epidemic. Hydrocodone, also known as Lortab, Norco, bananas, and fluff. Hydromorphone, also known as Dilaudid, Exalgo, Smack, Dillies, and Juice. Oxycodone, also known as OxyContin, Percocet, Percodan, Oxy, Perks. Oxymorphone, also known as Opana, Biscuits, Mrs. O, O-Bomb. Fentanyl, also known as Actique, Sublimaze, Apache, China Girl, China White, and Dance Fever. The chart shown depicts the three waves in opioid overdose-related deaths. In 1999, we saw the rise in prescription opioid overdose deaths. In 2010, we saw a rise in heroin overdose deaths. And then in 2013, we saw a rise in synthetic opioid overdose deaths. The opioid epidemic may be marketed by the media and some literary sources as a primary Caucasian or white issue. This issue affects everyone equally, especially African Americans. The rise of deaths of African Americans due to a drug epidemic is not a new phenomenon. In fact, there have been two epidemics that have wreaked havoc on African American communities. The cocaine, crack, and heroin epidemics of the past have caused high amounts of death and incarceration for African Americans. Although there may be bias in the public's response to the opioid epidemic in comparison to the past epidemics, it is apparent that this is an issue that needs to be resolved. African Americans are faced with an advantage that they have not had in the past, an opportunity to get adequate addiction treatment. This schematic represents African American opioid mortality rates in a span of 4 years from 2014 to 2017. As you can see, the numbers continually increase. The numbers shown in the graphic represent data from the CDC Morbidity and Mortality Weekly Report. As you can see, the rate of African American opioid-related deaths has steadily increased since 2015. Numbers represent combinations from large central metro, large fringe metro, and medium and small metro areas. Let's take a recap. We've discussed what the opioid epidemic is. We've defined what an opioid is. We've taken a look at common opioids used during the opioid epidemic. We've looked at the impact that the opioid epidemic has had on African American communities. Now let's take a look at proposed solutions. Perhaps you, a friend, or a family member may be interested in opioid addiction services. In efforts to reduce the amount of African American opioid-related deaths, we would like to highlight two efforts designated exclusively for African American people. The Substance Abuse and Mental Health Service Administration, also known as SAMHSA, has faith-based community initiatives that provide addiction assistance and resolution through faith-based organizations such as churches. The second proposed solution includes the implementation of culturally sensitive interventions that seek to provide balance to the ethnic and racial disparities on drug policy and advocacy for African American people to seek treatments. Those treatments include inpatient or outpatient rehabilitation, medication-assisted therapies, including buprenorphine and trauma